Hi everyone, this is Szenan from Szenan-Balance, the acupuncturist. I started a video before but it didn't work well, so I start another one. This is a live video, so every week I'll do a live video to share with you how to do distal acupuncture. This style of distal acupuncture is actually Dr. Tan's balance method. Today's topic is I'm going to talk about how we can use acupuncture distal point to immediate relieve ankle pain. Alright. So firstly, we're going to understand what meridian that around the ankle. So the joint cup will come with 6 meridian, so 3 foot in and 3 foot young, right? I'm going to show you. So in Dr. Tan's acupuncture method, it always comes with 3 steps. So this 3 step is how you diagnose where the pains, and we use meridian theory to diagnose. Okay. It is acupuncture 1, 2, 3. So acupuncture 1, find the 6th meridian. Okay, find the pain. What meridian? How many meridian involved with the pain? Right. That's what we're gonna find out. How do you know? Ask the patient. How do you ask? Ask the patient where is the pain, and ask the patient, say, using your one finger to point out where is the pain. So you don't want to get patient to use 5 fingers to go, here is the pain. And where do you know the pain? Which meridian is that? Okay, it can cover a lot of meridian. If you just say one finger and they say, oh, here is the pain. Now we know this is stomach meridian. If they say, oh, here is the pain from here to here, then we know there's 2 meridian involved in here. Okay, so this is the first step. The second step, we're gonna once you find out what meridian involved with the pain, ankle pain, then second, acupuncture 2 is finding the balance meridian. Okay, we call treating meridian as well. So according to step 1, through 6 system, and you'll be able to find balance meridian. You'll be able to find treating meridian. Then once you find out the treating meridian, then we're gonna go to this. That's it. You finish step 2, and you're gonna go to step 3, looking for the point. So where's the point? You're gonna use. I'm gonna show you how to do a mirror, okay? To use holographic theory to find the point on the treating meridian, on the balance meridian. All right, let's have a look what structure we have in your ankle. Okay. This is ankle, all right? In the ankle, what you can see, this is bone and joint, right, and tendons, all these tendons, okay, or ligament, right? So here's another one, right, joint that you can see. So of course there's nerve around it, or bone. Okay, I have friend come see me. I'll come back to you later. I have friend just come in that her daughter, because today's my off day, so I do my video, but her daughter have emergency things, had high fever and coughing, and she just came in. I get her to have just wait for me for a while. I'm gonna quickly finish this live video, Then I'm going to treat the patient later on. So here you go. We see the ankle structure, okay? Then this is what we need to understand, okay? Firstly, you need to understand, get the patient probably is a fresh injury, is very bad, inflamed, swelling. And if they need, you can put needle in. You still can put needle in, okay? Because we're doing distal, we're not putting needle on the ankle, so there's no risk. But it's very bad if you can't get any results with this method or other method, and you need to send the patient go to get an X-ray or ultrasound, because ultrasound can find out whether it's a soft tissue damage. An X-ray can find out whether there is bone fracture or not. Okay, even though they have fracture or soft tissue damage, we can still treat it. But in conjunction, we're gonna work with physio. We're gonna go with doctor or whoever. Okay. So I'm gonna go quick. So 3 meridian. So 3 young meridian in here. 3 young meridian. So the red one, bladder meridian, gallbladder meridian, and stomach meridian. So the blue one, okay, the blue one is hang on. The blue one is liver meridian, spleen meridian, and kidney meridian up here, right? So now we know those meridian. You're gonna ask patient where is the pain, and the patient tell you that. Then you move to the step 2. So step 2, I'm gonna introduce only 3 meridian. So 3 in meridian over here. Okay. If the patient said the pain is in the in meridian, you use in meridian on your hand to treat it. If the patient said the pain is on young meridian in here, then you can use young meridian to treat it. Simple, isn't it? Okay, so bladder meridian is Taiyang meridian, so we can use Taiyang, small intestine meridian, to treat it, to balance it. So this is gallbladder meridian, Shaoyang. So we use gallbladder meridian, triple burner, to treat it. Stomach meridian is Yangming meridian, so we use Yangming, large intestine meridian over here. Okay, Yangming. Okay, if the pain is in here, liver meridian, we can use Szenan-Balance meridian, which is pericardium in the middle, pericardium. Okay, right. And if the pain is in spleen meridian, which is Tai-in, so we use spleen, lung, to treat it, to balance it. If the pain is in kidney meridian, so we use hand Shaoyin, which is heart meridian, to treat it. Okay. So now this is system 1. It's easy, very simple. Okay. What are you gonna do? Use your hand to press to find out. Now we know where the treating meridian is. Now you just have to go to, if this case is in Taiyang meridian, which is bladder meridian, we're gonna use small intestine meridian. So what you're gonna do is use your hand to press on the small intestine here, okay, to find which point is more sensitive. Okay, when you get the most sensitive one, place a needle in. Simple. Place a needle in. Okay, so and that is, we finished acupuncture 1, 2, 3, right? The one thing that I want to tell you is any other place in your area in your body, okay, we most likely to treat muscle. A lot of things is in the muscle, but when it comes to ankle and wrist, it's very high chances in the tendons. So if you go to your ankle or your wrist, it's quite bony, not much muscle at all. Okay, quite bony, so it's a bone joint. and as well as tendons. So what you're going to do is you need to highly suspect that the pain is actually from the tendons. Okay, so if you needle, you get the pain, you get the sore point, you needle it, you get result, but not as good. You need to think about tendons. And how do you treat tendons? Needle the tendons, okay? So if there's the achilles pain, so an achilles pain, I normally treat two tendons on the hand, okay? So if you have a look in here, this is hand. If you think about this is foot, what is this? This is heel. And what's back in here? So the tendon on the pericardium here, it can be, you can use this to treat achilles. So this is not related to, nothing to do with meridian. Now this is just image. This is just mirror, holographic theory, okay? But if we put on meridian, what meridian involved in here? So the Achilles tendons is between taiyang, bladder, and kidney meridian, right? So where is bladder and kidney meridian? That what meridian can you use it to balance those two meridian? It's heart meridian and small intestine meridian. So heart and small intestine, they can balance bladder and kidneys, right? So which is in here. So if you go with your fingers, you find it. You can find it. There's tendons in here, okay? Tendons in here. So using this tendons or up here, the tendons are up here. Needle those tendons. So needle tendons in general will be no pain, but in some of my case, with needle tendons, the patient is quite painful. I don't know why, but in generally no pain. Okay, I'm gonna show you how to needle tendons. Okay, you don't need the big needles, you just need the small needle. You see, and this needle is actually 0.14. 0.14 times 15 mm, right? So you want the patient to hold the hand still. So for me is normally I just locate where the tendon is. So I locate with my fingers, and then I put needle. I know the tendon is in here, so I put needle over here. But at the moment I only use one hand. So what I'm gonna do is I'm gonna stick on here. You see, this is tendon. You can't see it, okay? You can't see it. But I'm gonna use my fingernail to mark it. Okay, I'm gonna mark it here, and I'm gonna mark over here. So if you can see that mark, there's too many mark in here. It's actually between here and here. Okay, so between here and here. So this is tendon over here. So I just needle it into it. Now when you needle tendons, you find, okay, you break the skin, and you find that it's a bit difficult to go in. So you just keep going, push it slowly, push it in. That's it. So when you needle the tendons or ligament, you want the patient, you want the patient, you tell them, keep it still, because if they move, may be painful, may cause some pain in there. So don't move it. Okay. So once you get the point, you can put more needle up and down or sideways, up to you. Okay, up to you. Then if this pain is in the joint, it's in the bone. If it's in the bone, you need needle to deep to touch the bone, to go into the joint. Okay, this is and the depth of needles. Okay, is holographic too. Okay, so we use the skin to twist skin, muscle to treat muscle, tendon to treat tendon, bone to treat bone, joint to treat joint. Okay, so you have to have this concept. So this is how we treat ankle pain. Okay, you see no blood came out at all. no blood coming at all, which because we are not needling vessel. Okay, this is the video that I just show you how to treat ankle. You will get instant relief, but in my experience, okay, you can treat it very well. Sometimes you stuck, okay, you use the same method at the work, but at some point it can't get any further. What do you do next? What do you do next? This is important. You need to change your strategy into global balance to treat the organs. To treat the organs. You may find treating the organs is good, but make to some point it can't get any further. Then what are you gonna do? Use moxibustion or Chinese herbs. Why do I say that? Because I've been seeing a lot of patients with this problem, and we keep going. You get instant relief for a start, and you get patients to go, and they're getting better and better, but it just can't get any further. Therefore, you need Chinese herbs. This isn't no one's gonna tell you this, because all the masters, when they do acupuncture, they just do acupuncture. They never think about, they didn't teach you how to use herbs, okay? And I do herbs. When it comes to a limit, I can't get any further, I do herbs, because I have the concept of when you're treating structure, you need to understand how the organ connect to the structure. Here's that. So we understand stomach and spleen control muscle strength, okay? And kidney and bladder control bone strength. Liver and gallbladder control joint and tendons, right? So you need to make sure all the organs function better. Therefore, the structure of tendons, joint, bone will get even further, will get better, and the result will last longer. If you find out they have internal disease, stomach problem, liver issues, according to Chinese medicines, then you find that once you treat those, plus the needles that we just told you how to do that, okay, you find that they will get, the result will last longer, and they will heal properly. So don't forget to treat the internal disease rather than just focus on injury, focus on the pain. Because I have a lot of failure if I just focus on the pain, and I find I can't get any further. Okay, in Huangdi Neijing it said, if the patient yin yang is weak and the structure is weak, yin yang and structure are weak, don't use needles, use herbs instead. This is in the Huangdi Neijing, in Su Wen. Su Wen teach us all about the theory of acupuncture. All acupuncture theory come from Su Wen. But Su Wen actually Ling Su actually tell us, don't use needle in some cases, and use herbs instead. Alright? I hope you learned something today, and share my video to your colleague, your friends, and if you like this video, I'll keep going every week to do a live video for you, and share it on Facebook and like this video, please. Thank you, and I love you. Bye bye.